I really like to get to know my patients. I always ask them about themselves, their work, what their interests are. We talk about their family. And only then, when I have a sense of who they are, and a lot of times I'll give anecdotes about myself, and we spend 5 minutes doing that. Then I'll ask them what I can do for them, what their concerns are. I like to listen to them, and then I examine them, and I try to offer practical solutions. I tend to be relatively conservative in how I recommend things to try to fit the lifestyle. Just because somebody has something that's structurally wrong doesn't mean it has to be fixed necessarily. I mean, you look to see whether it affects them on a functional basis. Many times it is a cosmetic concern for them that is a strong enough one that it's reasonable to do the surgery. I really like to spend time with people and make it very personal. And a lot of times after their final visit, after however many months it may be of post-operative management during their healing phase, it's almost like saying goodbye to a friend many times. I'm trained in ophthalmic plastic and reconstructive surgery, which includes all forms of reconstruction around the eyes, as well as cosmetic surgery. So this would encompass things ranging from congenital problems, that is, things that children are born with, whether developmental or injuries, to aging changes in adults, certainly some trauma with that. A lot of skin cancer, thyroid-related eye problems, drooping of the upper and lower lids, tearing disorders, as well as a range of cosmetic procedures all around the eyes. Anything that has some impact on somebody's face or vision. It's really nice, and it's actually very reassuring to know that I'm generally always in the office with 2 or 3 other doctors, because there are things that come up that may be just slightly outside of my particular subspecialty. Certainly it has to do with their eye. And they come in, and I'll call Dr. Seeger or Dr. Tingley, who I share the office with, and say, this is what's going on. What do you think about this? It's a great advantage for me, certainly. I don't have to refer a patient out to another office necessarily to get an answer. But I think it's good for the patient, too. They can get information right away, and we come up with a plan. Anything that's required can be done within the practice. We have a wide geographic area that we cover with 4 offices. We get referrals really all the way from Plattsburgh down to the southern tier as far west as Buffalo. I have more and more referrals from general plastic surgeons and dermatologists in town. There are many things that are unique to oculoplastic surgery. I mean, certainly there's an eye underneath the eyelid, and all of these things affect vision, the integrity of sight, the comfort, and I think nobody but somebody who's ophthalmologically trained understands the function of the eyelid as well as somebody like myself. And so I think we offer a very specialized service.